Elena, what's going on? How we doing?
Hello, hello. Hello, all the way here from Europe, from Poland. Hello, Dr. Brandon.
Call me Brendan. Call me Brendan. How's it going?
Great, great, very nice. We have finished for the day and super excited, super grateful for you dedicating your time and joining us today and sharing your journey and your advice.
Of course. Yeah, yeah. And I know there's differences between Europe and Poland to the United States, but we'll go into that a little bit. Sure. Sure. It'll be fun. It'll be fun. It'll be a discussion, right?
Very nice. I just to highlight a little bit about our from our side, our university. So our university is called like Poznan University of Medical Science, and most of us joining here are from English division. And also we have a Dental Student Association, which I'm a president of. And we also have dental specialties organization and numerous research groups, such as a Maxillofacial research group. And all the students from these divisions are going to be joining us today to hear and talk to us, maybe ask if they have some questions. So we're super grateful on behalf of the university and our organizations.
Oh, no, thank you. Thank you for having me. Yeah. Quite a
And
quite a big couple groups you're mentioning there. Wow, yeah.
yeah, well, overall, Poland, it has a lot of different universities that has English divisions as well. Even though our English division is not as big as, since we are international students here, but ne nevertheless, we are very enthusiastic and want to study and want to learn and find out new and exciting things, what's happening like around the world, and
Yeah.
especially in the States. Quite a few of us are from Canada,
Mhm.
some of us from the States. So going back home is very important for us.
Oh, I'm sure. I'm sure. Yeah. I'm not too familiar with how dentistry works in Canada after college, but I know that because I looked up Poznan and P. Do you call it PUMS or PUMS? I want to know.
PUMS, yeah.
PUMS. So PUMS, that's directly out of high school from the research I looked up on the internet, right? It's 5 years. It's a DDS degree, Doctor of Dental Surgery, and you come directly out of high school. Is that correct?
Exactly, yes. But we do have also students after finishing their bachelor degree as well, who wanted to shorten their time of studies or couldn't get into dental schools, let's say in Canada or US, they apply as well.
Hmm.
So minimum requirement is high school and like science courses, but overall we do have a different array of students here as well, especially for MD, because they have MD and before they had advanced MD program, and which did require bachelor degree as a
Mm.
prerequisite.
Oh, I see. I see. And then the regular MD program does not require a bachelor degree?
No, no. So it's like a 6 year for them here.
Oh, interesting. Is it a different timeline between the advanced and regular MD?
Yeah, so the advanced one, the year prior was 4 years for them here, which they included the 4 years already of the bachelor degree that they received, so it's together eight.
Mhm.
And this year they had a 100% success rate of match in the
Wow.
States. Yeah, so it's very nice. We're excited for them, and we wish our dental team as well would be very successful on our graduation.
Yeah, yeah. Are you trying to match into the United States? It's a little different here, the dentistry system.
Exactly, yes. So for us, I know the graduating students have attempted to like and succeeded in doing IMBDEs. So
Mhm.
some of them do it in after the fourth year, some of them after the fifth. So and then later on applying into I know interview, right, and so on.
Right. There are several dental schools here that take on international students, international dentists, and then matriculate them into the system here, but a little bit delayed. So you're not starting, it's a 4 year, dental school's 4 years in the United States, right? whereas Poznan I know is 5. They matriculate international dentists where they start 2 years in already, so they just have 2 years to go. And then as far as licensing goes, practicing in the United States, I don't know all the rules and regulations because I didn't go through that track, so I don't know all the nitty gritty details. But for the most part, that's my understanding of it.
Yeah, very nice. We do have a few alumni already that we stay in touch, and they guide us through the process a little bit. And our university does have cooperation with few universities as well. Just recently, we have cooperated with Penn University and with their professors. So hopefully the future is bright. And
Yeah, yeah.
but as well, we are super excited about the maxillofacial because, as I mentioned, that we do have a research group as well. Like my sister Valesa is also here with us. She's the president of that. And recently we competed in the conferences. We have the Warsaw conference, and few conferences are coming up where we present our cases as well. So the maxillofacial, even though it's a long journey for us, um, after graduating, let's say just general, then we have to go into maxillofacial. But it's an interesting field, I think, and we like oral surgery. So really, really excited. And same, I see our team has joined us here as well. So I know they would be very happy to hear your perspective and how is it in NYU there.
Sure, sure, sure. Actually, okay, so as far as maxillofacial goes, so that's mostly an MD track in Poland, right? Mostly in Europe as well.
Well, not exactly. So we have, let's say that even the doctors that we work with, they do like, let's say they finish their MD program and then they have to do a 2 years of DDS as well, or as if they started and finished their DDS, they do have to take few years, I believe 3 years of MD courses as well.
I see, I
So
see. So, yeah,
it's mixed together.
got it, got it. So it's mixed together. Some people come from the MD track, some people come from the DDS track into maxillofacial.
Exactly. Yeah.
Okay, and if they have their DDS, for example, they go into maxillofacial, do they earn their MD through the course?
Oh, well, it's like a long process, I would say. So first they have to apply specifically to the university, and then they once they complete those courses, then they have to apply for internship. And then later on, after I believe it's also like around 6 years as well, they have to until they complete everything.
Oh, okay, okay.
The
I ask these
internship
questions.
and receive their maxillofacial degree. Yeah.
Right, right, right. I ask these questions because I know oral and maxillofacial surgery in the United States is quite different. Like, for example, I'm in the oral maxillofacial surgery program here, and I don't get my MD. There are some residents that do, some residents that don't. And I did put together a little presentation. We could go into this a little bit, but you don't need to get your MD in the United States to be an oral and maxillofacial surgeon, which is very interesting. And but the cool thing about it is that you do all the same surgeries, right?
Yeah.
The MD, in fact, you could even go on to into fellowship training in further subspecialties even without the MD. Although it is looked upon as being beneficial in your application process to do a fellowship and further training and whatnot, it's not required. It's not necessary. It's not absolutely dire necessary. So it's just interesting the differences, the and
Mhm.
similarities between the United States, Europe, other parts of the world.
Yes, exactly. And I believe that in the States it's a little bit better. Maybe it can save a little bit of time and years in the long journey of the maxillofacial. So if you want to finish like just DDS, you can go ahead and apply. Of course,
Right.
your application has to be very strong, but nevertheless, but here, yeah, as you mentioned, but I know they work together with just general dentists. They can have consultations and things. They cooperate together. That
Yes.
and they invite to the department. It depends case to case.
Right, exactly. It does depend case to case. And another difference is because you said Poznan, you could go right from high school into the university for dentistry. There's no chance at going from in the United States going from high school into a dental school. They require you to get that 4-year college degree prior. So yeah, it's just all the years, all the training, all the education. It's a lot.
Yeah. Well, it's worth it at the end, but I know sometimes we lose concentrations on our journey there, but
Right.
it's it's not easy. Let's say like I can speak from my side. Like I have finished dental hygiene degree in Canada, and
Mm,
then after high school, and then that's why I have come to Poznan as well because it offered a much better faster route and in terms of expenses as well, much
mm,
better as well. So they have included, that's another thing which is very positive about our university. They take into account the courses you took before.
mm.
So specifically, let's say periodontics or certain anatomy courses, they do take into account so you don't have to attend all the lectures, even though you do have to write an exam at the end, but you still have a little bit of freedom in terms of that.
That's always nice. Freedom is what we end up looking for at the end of the day, right? We need a little more time.
Exactly, exactly.
All right,
Yes.
so we're about 13 minutes after, I guess that's 7 o'clock your time. Why don't I have a little presentation to go through the route of oral maxillofacial surgery, the path that you need to go through school-wise, the education system in the United States. I know that might not directly apply to Poznan. However, let me try and speed through that to give you an idea, and then any questions that I can answer. I want to open this up to everyone, and any questions I can answer, we could get to it, and I'll try my best. I can't answer on behalf of Europe or Poland or Poznan, but I'll do my best to answer any questions I can, and then we could
Oh,
discuss.
sounds good. Very nice. Thank you so much.
Yeah, of course. Of course. Anything I could do. Okay, so here we go. Let me just get this to the side out of the way here. All right, so that's me. I'm Brendan. Maybe you guys have seen me on one of the social media platforms. You should all get LinkedIn, by the way. LinkedIn is very important right now, especially professionals, but it's also a professional space for education and professional development, I would say. Sharing concepts of this, showing this case off there. Cases do very well there. I noticed on Instagram, a lot of people share their cases of x-rays and veneers and crowns and before and after. And no one looks like that. No one looks at that on Instagram, right? It goes heavy on LinkedIn. All those posts should go on LinkedIn. Anyway, I could go on. I love the science behind social media and human behavior as well as attention. And so we'll go into that. Just right. I'm a 4-year resident. I don't get my MD. I have my DDS, just like you get at Poznan after 5 years. In the United States, we go from high school into undergraduate, college or university, you can call it, right? That's 4 years. From that 4-year degree, then you apply to dental school. Dental school here is 4 years. From dental school, then you can apply into specialties, like you mentioned before, periodontics, oral maxillofacial surgery, endodontics, and so on and so forth, right? In oral surgery within the US, you have two different systems, and they both can do, I can't overrun this enough, they both do the same oral and maxillofacial surgery upon graduating from the program. The two tracks are, one is 6 years, one is 4 years. The 4-year, you go right through. You do mostly oral surgery, you do off-service rotations in general surgery, plastic surgery, and so on. So do the 6-year residents. 6-year residents get their MD, however. Those extra 2 years are spent in medical school. So they get their MD, but I don't know if you know this, but like in the oral surgery, in the maxillofacial surgery, certainly, but many times you're not using the certain areas of the medical knowledge in practice in the day-to-day maxillofacial surgery. It's very, very interesting. That being said, preference is whatever you want, right? My personal opinion was that if I'm not going to use that MD, I have the utmost respect for it. That's not the question. But the question is, why would I spend another 2 years of my life, the time, the money in the education That's something that's not going to translate into your everyday, day-to-day work, life, and profession, right? Directly, I mean, directly applied. So that being said, let's keep going. I don't mean to talk your ear off in a tangible subject. So Top Professionals LLC. I have two startups right now, and then Bay Marketing Agency. These are basically two marketing agencies. One kind of does more content editing and setting up companies or dental practices, for example, with their social media platforms, and how to create content, consulting on what content to create, how to edit it, and where to post it. That's becoming ever more important in today's day and age, as I'm sure everyone can recognize. And I think it's fascinating because essentially social media has become, for patients, it's almost like a pre-consultation. You know, the first appointment you have that you bring a patient in, you meet them for the first time, yada, yada. But patients might not necessarily like you or trust you or want to have surgery with you or want a second opinion of you. They can get to know you even prior to coming into the office these days. This is something I'm beginning to talk more and more about because social media can be utilized for a lot of positives. And now this way, when patients don't feel comfortable with you, you can filter those patients out before they even come in the office, right? You want to be working on patients that trust you and are comfortable with you. And I think social media is a great platform to utilize for that. So marketing stuff, Vape Club is a subset in wineries, breweries, cafes. I do top wineries on Instagram as well. Top professionals includes students of dentistry. I think you guys, we actually had a student on our, if you notice the password today, I put pre-dent map. It's a service. It's only for the United States right now. We're adding on Canada. Elena, you mentioned Canada. We're adding on Canada next. And I'd like to get back in our initial version, our first launch, we had a student from Poznan. And I got to reach out to her, see if we can get her back and start to increase this pre-dent mentor map where pre-dental students, whether in high school or college in the United States, are looking for more information for free for dental schools throughout the United States and the world. We're putting together a compilation on a map of all the dental schools out there to allow you to get free data there, right? Now, this doesn't apply to you, but I really feel strongly about making this profession better for the people coming into it. And so is my partner that I co-founded that startup with. And so when we add Poznan to the map, if you'd be so kind to sign up and join us on this endeavor to leave the profession when we go out in 30, 40, 50 years better than when we get into it, okay? So that's a topic for another time. Oral and maxillofacial surgery residency application process. Now, this is more applicable for United States dental students, but I'm going to try and do my best to tailor it to you. All right. You have dental school specialty placement history. This is about dental schools, right? And this does apply to you. I would look at the history of Poznan. You said PUMS, right? I would pronounce it PUMS, but you said PUMS. So let's say PUMS. You want to look at where does your school have a very good history of placing into? You said before that you guys match really well into medical residencies throughout the United States. Excellent. What's the data and statistics for matching into dental schools, into dental residencies? Okay, I don't know what that is, Elena. Maybe you know, but that's what I would look at when you're looking at a dental school. And why is that important? Because if you match a significant number of students into a certain specialty, into a certain area or country, you're more, someone's coming in, I'm just going to admit them. The school historically is most likely to follow that pattern in continual years. Now it's not going to be exact, like it's not going to be 10 every single year. You know what I mean? That makes sense. Okay, so class rank and GPA, these are obviously very important. Your GPA needs to be very high. It does not need to be perfect. You do not need to have a class rank of 1 in the class. I don't know how it is for PUMS, but in the United States, this is how it generally goes. Okay, you don't need to be number 1. It's recommended. You want to do your best. But the reason I bring this up is because I think a lot of students get confused. They think they need to get a higher score than everyone else. They need to be better than everyone else. They need to answer questions faster than everyone else. And this is honestly, I would consider this a very toxic mentality. I would adjust this perspective into saying, rather, I would suggest be the best you can be for you. Get the best scores you can get. And you should not have to compromise your character or personality in order to excel or advance in any profession. You should just be going in, doing the best you can every day and pushing yourself to be better than you were yesterday. It has nothing to do with anyone else. It has nothing to do with other people's test scores. It has no association with other people's relationships with the colleagues or professors or this and that. And I saw that a lot in dental school. I was a bit disappointed with that. And so the message I want to try to portray here is someone else's route or journey through a career or profession has nothing to do with you. And you should allow and only have your passion and happiness guide you. What makes you most excited and go in that direction? And if you need a high GPA, go in on it, but it doesn't involve putting other students down or giving other students incorrect previous exam to study for. Yeah, stuff like that goes on. I know, but for another time. The CBSE, getting into oral maxillofacial surgery in the United States requires you to take the CBSE. CBSE stands for Comprehensive Basic Science Examination. It's basically the NBME, which is the medical school first part board exam. It's just shortened. Instead of like 300 or whatever questions is, it's 200. You have 5.5 hours to answer. We could get into that further. But this is the admissions test for oral surgery within the United States. Letters of recommendation from faculty, externships. That's when you spend a week in the United States at one of the programs there and you get to see them. Research can help. It's not required. And then interviews and such. This is what I mentioned before about the match history of a dental school. Kind of gives you a good idea of where your class will be when you graduate and where you're going to match in the years to come. Okay. Class rank and GPA preferred, but do not change your personality or character to try and get yours, so they say, right? No. This is the CBSE exam. It's only offered twice a year in the United States. This is the website where you can register for it only twice a year, either in July or August, and on the other side, January or February. Twice a year. They close the portal about a month and a half out, so you need to register for this 2 to 3, 4 months out. Okay, you can take it 6 times when you're applying to oral surgery residencies, and some of the statistics there. I really want to get into Q&A. Let me try and brush through this here. CBSE stuff, letters of recommendation. You know what a letter of recommendation is. Externships. I said that you spend a week at a program. They get to try you out. You get to try them out. See what they're like. See what surgeries they do. What their culture's like. You know, do the colleagues stick out for each other and whatnot? How is their call schedule? Research, again, not required. That's the website that you apply on. Interviews in the United States after you apply go out anywhere between usually like August and, like I said here, November, December. Okay, that's when interviews happen. Match day, you guys know match day when you match into a program. It's in the end of January. Okay, I put this presentation together in October 2021. It's been a long ways from there, but this was my Instagram. If you want to follow me, follow me or not. If I can help you with anything, really answer any questions, keep in touch. You need further information. You need to get connected with someone in the United States that has I have a few friends who are international dentists and they studied in India or in Europe and they came to the United States and they can answer questions that I can't. If there's anything I can do to help you, get in touch with them to help you, let me know, okay? And I give you the Instagram here because send me a DM there. That's where I see notifications quickest. It might take me a few days to respond, but nonetheless, I will. So that's my grandmother. So just a quick story. She a year before I started dental school, she was diagnosed with a metastatic cancer, and it came back. She had it in 2001, and it came back in 2016, 2015, 2016, and a week after I matched to residency where I'm at now, she passed away a week later, but she made it. And why do I bring up this story? Because you need to stick to your goals. All right, I'm going to open this up so I can see everyone. You got to stick to your goals, right? You need to stick to what your dream is. You need to push for it. And you know, your parents, your family, your friends, they're proud of you too. It can get very brutal, this career path, right? Everyone knows it. It's stressful. There's a lot of anxiety. There's a lot of studying. There's a lot of sacrifices, and other professions and career paths may not understand how much sacrifice is put into the healthcare career path. But you do know it, and you need to go for it, okay? And always appreciate where you came from, your knowledge basis. Friends and family always come first. Patients always come first. Your colleagues come first. And even before that, you yourself as well come first. All right. So I don't know. Just take it for what you will. But let's get into question and answer. Is there any way? Yeah, I think everyone can talk. I don't have anyone on mute. How can I answer your questions to help you out?
Hi, my name is Andrew.
Hey, Andrew.
I'm currently second year from Canada. I spoke to a couple different alumni who have been looking at the pathway back to the US, and two of them mentioned that you should have a letter of recommendation from the actual like state that you're applying to. Other ones said that you only need a letter of recommendation from the US, like a dentist you know or like institution. Do you have any input on this?
So now I don't, and I haven't applied from outside the United States. I'm born and raised in New York. I went between the area, between schools, college, high school, dental school, now residency. So whatever I say, take it with a grain of salt because I haven't come from that exact career path. That being said, what I would say is it makes sense that they're in that state and nearby that location, right? The best thing I recommend to dental students, and this may apply, if you know, now look, now you're in Poland, right? For the most part, you're from Canada, I know, Andrew, but if you're going to get a letter of recommendation from anyone, the best possible person to get it from is probably a faculty member in that program, right? Now, I don't know how you'd be able to do this and coordinate it flying, spending a week, a month in the United States at a dental school that you're looking to go to or a residency program you're looking to go to. I know it's very difficult, but I would recommend there are a lot of faculty members at dental school in the United States right now that work part-time. In fact, maybe 80 or 90% of the attendings dental school faculty members, the dentists that work there and teach, they're part-time faculty. They have their own practices. So a little hack is to figure out, now it's hard. You got to do a lot of Googling. I would look them up on LinkedIn. I would figure out who works at a dental school, who has a private practice, and I would shadow them in their private practice. It's hard to get the acceptance and the access into a dental school to work there with all the rules and such. But at someone's private practice, you can absolutely ask to shadow or observe them, come in for a day, couple days in a week, and just show that you're really passionate about the profession. You're super interested in studying in a dental school in the United States. I think that would be your hack to getting a letter of recommendation that's very applicable to that dental school, right? They're a faculty member there. Or they're a faculty member there and you're applying to another couple schools. That helps. Now, look, I don't know how you do this, and you're all the way over the pond in Europe, right? But this would be my best recommendation with the very limited amount of knowledge I know on that path.
Thank you so much.
Does that make sense, Andrew?
Yeah, that's actually amazing advice. Thank you so much.
You got it. You got it. How's everyone doing today? You said you finished the school? Liana's gonna. What's up, Liana?
Yes, hi. I have a quick question. What would the process be like if we were to decide to specialize, say, in Europe, and then eventually try to, move to the United States?
So I'm not familiar with the specialization process in Europe. I don't know of it at all. I do know that there are different career paths into maxillofacial surgery, and then there's oral surgery, and then only some of them can do sedations, for example. Only some of them have the DDS, only some of them have the MD, some of them have both. In Europe, to me, being in the United States, very complicated, very confusing. In the United States, it's just it's oral maxillofacial surgery all in one umbrella. Very few of them are starting from the medical side of healthcare into maxillofacial and oral surgery, right? Most of us, like 95% or more, maybe even 99% or more in the United States, all come from dentistry, and then we get into oral surgery. And that's when we get into the residency where you either get your MD or just the training and go. Again, the MD residency is 6 years. Just the DDS, where you just get a certificate in oral maxillofacial surgery, is 4 years, and then you go and you can practice under that license, right? I don't know that if you're going to apply, there's some paths where you can just get kind of like a refresher 2 years in dental school in the United States and then apply into residency. If you've already completed your residency in Europe, it doesn't transfer like that just directly into the United States. Does that make sense? All right, we got 10 minutes left. This went fast. I'm sorry. Andrew, what's up? And then Alicia, why don't you go first? Because Andrew, and then we'll go back to you, Andrew.
Hi, thank you again for doing the presentation for us.
Of course.
It was a pleasure hearing everything you had to say. I have a question in terms of research. Do you conduct any research at your university program Do you take any students on, for instance?
At my residency program, or did I
Yes.
do research previously?
In your residency program, like currently?
Yes, yes, I did. I did two projects actually this past year, and they did involve dental students. They only involve dental students at the university that my residency is linked with, though. I'm not familiar with how to get in touch with students and such from overseas. It would have to be facilitated with most research by, you know, the not sponsor, what's it called? This basically the supervisor, who's a faculty member, like above a resident like
Okay.
myself. And then he or she coordinates between the dental students, the residents, maybe overseas. He's the guy I'm thinking of is from Germany. I wish I could answer that more fully.
My question is, would you guys be even willing to do like a collaboration with our university in terms of research projects? We do have a lot of research going. There could be like retrospective studies, some original works, for instance, or case reports, if that's something that you guys are willing to do.
Actually, that's a really great idea. If I could get whoever's interested, I would like to forward that information to my supervisor, the person who I worked with the project with. I'm kind of on my way out, like in the sense of I really don't want to get involved in more research projects right now. In my opinion, it gets very involved. There's a lot of time. You have to rely on grants and such. It could be a very expensive time process for the amount of data that may or not, sometimes it can't even be used. I just had some experiences with research, and I'd rather do stuff that is applicable now or in the years to come, if that makes sense.
Yeah, for instance, like I think it's very interesting, like our partnership right now. You mentioned that across the seas, yeah. So a lot of people want to go back to North America, let's say US or Canada, and then you have Europe, and how, let's say, how the education, you can even always compare the level of education or the level of like different techniques and opinions in,
Right.
let's say, maxillofacial residents that are currently here, and then compare that to do like a survey based in US and Europe program. If that's something you guys are interested in doing, then that would be nice to follow up.
Oh, that would be awesome. That's such a great idea. That's such a great idea. Yeah. Yeah. And I don't know how I could definitely connect the dots. I can put two and two together. I can help get in touch
Yeah.
with you.
I think it's for sure something very feasible to do. And like in terms of the grants, I don't think that would be an issue
No,
in that perspective. So
true.
I
True.
guess we can stay in contact regarding it.
100%. I can get you in touch with Dr. Wiederman in
Okay,
an instant.
awesome.
That would be great. Yeah.
Thank you. And I think Andrew has one more question. So
Yeah. Yeah, Andrew, what's up?
Oh yeah, this is like a quick two-parter. Actually, maybe not so quick. I was wondering, first part is what made your decision about the 4-year program versus 6-year program? Was it just the fact that you weren't going to use the MD knowledge in your day-to-day practice? Did you consider branching out to do more maxillofacial or more oral, like tooth extractions, or more face work? Additionally, I was wondering, do you know how much of an influence having research done in like undergrad and taking years off to do research, how that would influence applications and your likelihood to get accepted into a specialization in the US?
Got it. Okay. And we have 5.5 minutes left. I'm going to try and summarize this really quickly. First question you asked was the only reason because I wasn't going to use it day to day? Yes. I will not be using an MD day to day in oral maxillofacial surgery when I get out in private practice. So why would I get it? In residency training, we utilize that knowledge basis anyway. So I know how to do that stuff in a practice setting. I just don't have an MD. So it's my solely opinion, it would be like not feasible to spend 2 years of my life potentially paying tuition to get something I'm doing, but I don't need, right? Does that make sense? So second question was, did I consider that? Absolutely. I did consider further training and understanding and practice, but for what I want to do, big implant cases, zygomatic implants, all on X cases, combined cases with prosthodontics, periodontics, perhaps general dentistry, cosmetic dentistry, any tooth extraction. I feel very comfortable taking out pretty much any tooth in the face right now. But major jaw surgery, I'm still learning, for one thing. And the passion is like, you could see maybe a handful of patients in a day in the OR doing these massive surgeries. I've seen literally probably upwards of 40 patients between different clinics, shares being the help of assistants and nurses and such in the hospital. So it's also a quantity versus, like, you get a lot bigger cases. You could quantify that as maybe quality, but the quantity, you could see so many more people and help so many more people. I think doing some of the, I don't know, some people in this profession talk down those things, but I think seeing more people, it can be very beneficial in a course of a career, right? And that's that. I'm not saying it's more beneficial. I'm saying very beneficial. I think it serves my interests in such a way. Does that make sense? The third question was research. Research can be helpful. It is not something to do in exchange of other things such as test scores or GPA or externships or letters of recommendation. It can be helpful. It's going to be most helpful at those programs that have research-oriented faculty, attendings that are involved in research. There are many programs that they're not as involved in research, right? And therefore, they might not be picking you out of the pile, so to say. This person is extremely exceptional and experienced in so-and-so areas of research, right? They're not doing that themselves. They're probably not going to pick you. So what I would just say is if you are involved heavily in research, you'd want to apply to programs that are also heavily involved in research. They're most likely to focus on your application rather than mine, for example, right? I did do research in undergrad on the nuclear core complex of cells, Werner's helicase gene. I did do research on implants and laser therapy for periodontal defects, periimplantitis defects around the implants in dental school. And I did do kind of like almost like a retrospective study in residency. So I did it, but I mean, I'm just assuming that you have more experience in that realm. Okay, next question. I want to make sure. And does that make sense, Andrew? Just let me know.
Yeah, it makes perfect sense. Thank you so much.
Yeah, you got it.
Yes, thank you so much. And actually, I know a few of my colleagues at work. They follow your account and they're big fans of your social media. Even like the dentist there. A few of my coworkers have attended NYU for their implantology. They have a famous program there.
Oh, yeah.